All right, this is a video on contamination and how to solve contaminations that happen in the OR during your competency, just to help give you guys some more explanation here. So we're just going to do a few things and explain them to you as we go. Okay. So Casey's just scrubbed in. She's got her circulator tying her up. She's putting on her first glove, and never fails, this happens to you guys a lot of the time when you're putting on your glove and you're nervous and all sticky. Oh, you've ripped your gown. So Casey's fingers on her left hand have now touched her arm. So her fingers are contaminated, her arm's contaminated. So how do we get out of this? Casey's just going to break out because she has contaminated her scrub. She's contaminated her arm and her fingers. So at this point she cannot save her scrub. That's why we call it breaking out. So she's just going to break out of her gown. She can ask her circulator to open her a new gown and gloves while she goes out to re-scrub. They can open a gown and gloves just like you. So have your circulator open gown and gloves, and she's going to come back in after doing another scrub and re-gown and glove again. So that is getting a hole and contaminating yourself with only one pair of gloves on. Okay? So this next scenario, Casey is putting on her gown and gloves, and when she gets to the point of tying her gown, she has a brand new circulator who doesn't know how to tie. And
oh, you just touched my hand.
Okay. So Casey has one pair of gloves on, and this is, she has one hand contaminated. So Casey, how are you gonna fix this?
So if I take my glove off with this hand that's still sterile, then I have one hand that's exposed. Remember, we can't pull the white cuff back down, so I would be attempting to open glove myself off a sterile surface, which is never good. So that's not allowed. We can only close glove off of a sterile surface. So my choice here to try to preserve my scrub and save time is to have my circulating nurse peel me out, similar as to how we practice in the competency assessment when we want to help our surgeon go from below to back above to that clean area. So I'm not tied here in the front yet. So my circulating nurse, she's going to help me in the back to untie and unvelcro, start to release that gown from the back side, and then pull it the rest of the way off, and then pull my gloves off using the hook method so that we can attempt to preserve the scrub. And then you will have to have that unsterile person assist you with opening another gown and gloves. Remember that if you want to preserve the scrub, you can't be touching the outside dust cover of the gown or the glove wrapper, which are considered unsterile. Okay, so they'd open those items onto a Mayo stand. You don't have to go out and do a scrub. You come back in. You don't have to come back in this time because we were able to preserve the scrub, so you can just go ahead and start donning that gown and gloves again.
Okay, so again, that was one pair of gloves on with a contamination where you didn't have a hole in your glove, so your scrub was still good. So that's why we could peel Casey out to preserve her scrub. And then the circulator could open a gown and gloves. She just stands there with her arms out, preserving her scrub while they open her gown and gloves, okay?
All right, in this scenario, the tie falls off the card, which happens in real life, actually, not just in lab. All right, so we want to try to preserve the gown if we can. So as a sterile person, I want to face my sterile field, but be sure that I'm back far enough so that my unsterile person can help me with this. So I'm going to lean forward. They're going to attempt to grab that tie without touching the gown. They're going to reach in the back of the gown and attempt to tie that short tie to the long tie as far back as possible, and then rip off any of that excess tie so it's not going to come back up and contaminate during the case.
I'm just not going to rip it to preserve the gown in lab, but yeah. Okay, then Casey's going to go ahead and put her second pair of gloves on before we show you the next contamination. So the next one is the next few are going to be if you have two pairs of gloves on. So it may be while you're setting up, it may be in the middle of the case. So we have two pairs of gloves on.
Okay, so on this one, I'm gonna look in my indicator. Oh, my indicator happens to be bad. Okay, so circulator, can you call for a new instrument set and also get me a new pair of size 7 outer gloves?
Okay.
And I'm gonna get rid of that. Okay, now, I only have one hand that's contaminated, okay? Be aware of that. Make sure you're not gonna bring your hand back, touch anything else, carry the contamination, okay? So I'm gonna grab my gloves, wait for the wrapper check.
Wrapper's good.
Okay, and I can set that on my back table, making sure I'm not reaching my contaminated hand over the back table over here, okay? All right, so because I only have one hand that's contaminated and I have 2 pairs of gloves on, I can take my outer glove off, okay? So I'm gonna grab, go ahead and pull that off. And again, not put this on the back table to carry the contamination anywhere else, drop that on the floor. Okay, if I was concerned about if it was a hole, I would double check to make sure it's not through both layers, okay? Obviously to make sure if there is an actual contamination that we need to take care of. But this one, just through the outer layer, take that off, and then I can re-glove myself with that outer glove.
Okay, so to recap, that was 2 pairs of gloves on, 1 hand contaminated, or sorry, yes, 1 hand contaminated. You can take the outer glove off yourself and then proceed putting your own gloves on if there is no hole in the underglove. Okay?
Okay, so in this one, I check my indicators, they're both good. Pick up the instrument basket, ask my circulator to check the filter.
Oh, you have a hole.
Right, so I'm gonna need a new instrument set.
Okay, I'll call for one.
Also a new pair of outer gloves, size 7. Okay, so obviously my circulator could toss those on the back table for me if they wanted to. Otherwise, we're gonna have to wait because both my hands are contaminated. So I don't wanna go in there and touch that sterile item. And
Okay.
then they're gonna have to help me to take my outer gloves off. When both hands are contaminated, you cannot safely peel off your outer gloves without risking contamination of your gown. Okay?
So ideally, so we're gonna say right now, Casey's setting up for her case, so there's no blood. Patient's not in the room, so I don't need exam gloves. If there was a patient in the room and the case had started, I would need to put exam gloves on, okay?
Okay, once that glove is off, this one's now sterile, so I can help her to hold that other glove on so that I'm not gonna accidentally have my underglove taken off as well.
Okay.
Okay, she's gonna give me the new gloves if they haven't made it to the field yet. I'm gonna wait for the wrapper check.
You're good.
And then don my outer gloves off the back table.
So that was 2 pairs of gloves on. Both hands are contaminated. You have to have a circulator. Somebody unsterile, take them off. You cannot take off your gloves when both hands are contaminated. Okay? Now let's say in that same scenario, so Casey has grabbed the instrument basket. I'm checking the filter. Oh, you got a hole. Okay.
I need a new set, please, and a new pair of outer gloves.
Okay.
Okay. Yep, and I'll have to wait, obviously,
Okay.
till I get my gloves changed.
Okay. So let's say I'm going to take off her gloves and I cannot get her blue glove, her indicator glove to stay on. So how do we get out of this situation?
Okay, so if somebody else is sterile and they're scrubbed in, then we do have an option for them to re-glove me. But there is not an option for you to re-glove yourself when your hand is bare like this, okay? Because again, that would be open gloving off of a sterile surface, and we can only close glove off of a sterile surface.
So since in this scenario, Casey's setting up and she's the only one in scrub, she's going to have to break scrub at this point. She can open her own gown and gloves or have the circulator do it to save time. She'll go out and re-scrub and then come back in gown and gloves.